Hello and welcome. Today, we're going to talk about a topic that can be confusing and honestly a little scary for a lot of people: vaginal bleeding. Our goal is to cut through the noise and give you clear, straightforward information so you know what's going on and when you should get some help. And that's exactly what we do here at MediByte. We demystify medical topics just like this one, giving you information you can trust. So let's get right into it. Okay, so we're all pretty familiar with menstrual periods, right? But what about bleeding that happens outside of your normal cycle? How do you tell the difference between something that's just a little weird and something that's a real signal from your body that you need to see a doctor? To make this super clear, we're going to break it down. We'll start by defining what abnormal even means. Then we'll walk through the different stages of life, the childbearing years, postmenopause, and even childhood. And we'll wrap it all up with a clear action plan so you know exactly what to do. All right, first things first. Before we can talk about causes or treatments, we need to be on the same page. What is abnormal bleeding? Well, the definition is actually really broad. It's basically any bleeding at all that isn't your regular expected period. And here's a key point. Even though we call it vaginal bleeding, the source could actually be the uterus or the cervix. Figuring out where it's coming from is a big part of the puzzle for your doctor. Now, there are certain times when any bleeding is an automatic red flag. Seriously, any at all. This includes before a girl hits puberty, any spotting or bleeding between your periods, any bleeding during a pregnancy, and, this is a big one, any bleeding at all after menopause, which is officially defined as a full 12 months after your very last period. And it's not just about bleeding between periods. Your actual period can be abnormal too. We're talking about cycles that are either too short or too long, a period that drags on for more than 8 days, or if the blood loss is just really, really heavy. And don't worry, we're going to define what heavy means in just a bit. Okay, let's zoom in on the childbearing years. This is really when most of the questions about weird cycles and unexpected bleeding tend to pop up. So if you're not pregnant, what's the number one reason for abnormal bleeding? 9 times out of 10, it comes down to a hormonal imbalance. The fancy medical term is ovulatory dysfunction, but all that really means is that your body's hormonal signals are a little out of sync, which causes your uterine lining to shed at the wrong times. Of course, hormones aren't the whole story. You've also got things like uterine fibroids or polyps, which are non-cancerous growths. Your birth control method can also be the culprit. That breakthrough bleeding is super common, especially when you first start. And this is really important. Unexpected bleeding could be a sign of a pregnancy complication, which is why a pregnancy test is almost always the first thing a doctor will do. All right, let's shift gears completely and talk about life after menopause. And when it comes to bleeding in this stage, the rule is crystal clear, and it is so, so important. If you only remember one single thing from this entire explainer, please let it be this. Any, and I mean any, vaginal bleeding after menopause is considered abnormal and absolutely needs to be checked out by a doctor. No exceptions. It is always a signal to investigate. So, why is this rule so strict? Well, it's all about being safe. See, the most common cause is usually harmless. It's often just a thinning of the tissues from the hormonal changes. But the doctor's job is to rule out the most serious possibility, which could be a precancerous condition or even cancer. And that's why every single instance has to be checked. Now, let's touch on a topic that's pretty rare, but incredibly important: bleeding in children. For any parent, this can be really alarming. So let's get clear on what might be happening. The cause of bleeding in kids really depends on their age. In the first couple of weeks of life, a newborn baby girl might have a little bit of bleeding. It's totally normal, and it's just from the withdrawal of her mother's hormones. But during childhood, it's usually caused by something different, like a small injury, an infection, or even a tiny foreign object like a piece of toilet paper. In some very rare cases, it can be a sign that puberty is starting way too early. And just like with postmenopausal bleeding, the rule here is absolute. Other than that brief newborn phase, any vaginal bleeding during childhood is not normal and means you should see a doctor right away to figure out what's going on. Okay, we have covered the what and the why. Now for the part you've been waiting for, your action plan. When do you actually need to pick up the phone and make that appointment? You need to pay close attention to these warning signs because they mean you need to see a doctor immediately. We're talking about extremely heavy, excessive bleeding, passing large blood clots, feeling weak, dizzy, or lightheaded, and, like we've said, any bleeding after menopause. Also, if you notice other things like you're bruising super easily, that's another reason to get checked out right away. So I promised we'd define excessive, and here it is. This is the clinical guideline that you can actually measure, soaking through more than one pad or tampon every hour for more than 2 hours in a row. That's a clear, concrete sign that the bleeding is heavy and you need immediate medical attention. Knowing what to expect can make that doctor's visit a lot less stressful. It'll usually start with just a conversation about what's been going on. Then there's typically a physical exam. For women in their childbearing years, a pregnancy test is standard procedure. From there, your doctor might suggest other tests like blood work, an ultrasound, or maybe even a small tissue sample called a biopsy to get to the bottom of things. Okay, let's boil it all down. Here are the key takeaways. Number 1, for non-pregnant women, hormonal imbalances are the usual suspect. Number 2, bleeding after menopause always needs a doctor's visit, no exceptions. Number 3, the same goes for bleeding in children. Always get it checked out. And finally, never ever ignore those big warning signs like super heavy bleeding or feeling dizzy. We have covered a ton of ground here, and I want to leave you with this question to think about. Now that you have this knowledge, what's one small step you can take to be more proactive about your own health? Maybe it's tracking your cycle on an app, or maybe it's finally making that appointment you've been putting off. What's your next step? I really hope this explainer gave you some clarity and peace of mind. If you found it helpful, please give it a like, share it with someone who might need it, and subscribe to MediByte for more health information you can actually understand. Thanks so much for watching.